Hello, and welcome to this Women's Health Educational Session. My name is Diane Koster, and I'm the Women's Health Grant Specialist and a certified clinical health coach at Genesis Health Systems in Davenport, Iowa. In my role, I oversee the grant programs that provide free breast and cervical cancer screenings, as well as screenings for heart disease and stroke risk factors to women facing financial barriers. I also provide health coaching related to healthy lifestyle choices and general health navigation for women living in Scott, Clinton, and Jackson counties in Iowa through the Care for Yourself Wise Woman program. I will share my contact information at the end of this presentation if you or someone you know has an interest in learning more about the programs I've referred to. Did you know that African American women have a 31% breast cancer death rate and have only a 5-year cervical cancer survival rate? These numbers are alarming, but breast and cervical cancer screenings can improve these rates. Screening means checking your body for cancer before you have symptoms. Getting screening tests regularly may find breast, cervical, and colorectal or colon cancers early, when treatment is likely to work best. Lung cancer screening is recommended for some people who are at high risk. My goal with this session is to educate those in a higher risk category about general risk factors, cancer screening guidelines, and information related to breast and cervical cancers. Your participation is very much appreciated. When should you start screening? Talk with your doctor about your risk factors and any symptoms you may have, and that could change your personal recommendations for screening. Breast cancer screening guidelines. Age 40 to 49, baseline mammograms are encouraged. Age 50 to 54, yearly mammograms. Age 55 and older, yearly or every other year mammograms. Cervical cancer screening, advised that they start at age 21. Colorectal or colon cancer screening to begin at age 45, which was just lowered from the age of 50. Breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. Breast cancer can begin in different parts of the breast. A breast is made up of 3 main parts: lobules, ducts, and connective tissue. The lobules are the glands that produce milk. The ducts are tubes that carry milk to the nipple. The connective tissue, which consists of fibrous and fatty tissue, surrounds and holds everything together. Most breast cancers begin in the ducts or lobules. One in 8 women in the United States will develop breast cancer in her lifetime. Early detection is the best protection. Some breast cancer signs and symptoms include constant breast or nipple pain. The nipple is inverted, turning inward. Rash or color on the skin around the nipple. Change in size or shape of the breast. Dimpling or change in the skin texture. Lump or thickening in the breast or underarm. Swelling of all or part of the breast area. Unusual discharge from the nipple. You can greatly reduce your risk by getting regular mammograms. Keep a healthy weight, exercise regularly, limit your alcohol intake, know your family history, stop smoking, know what's normal for you, and get a yearly breast exam according to the guidelines. A clinical breast exam is an exam by a doctor or a nurse who uses their hands to feel for lumps or other changes. The lump or some pain may be normal for one person, but not for another. If a lump is considered your normal, then there is nothing to worry about. If that lump changes, grows, becomes painful when it wasn't, etc., then speaking with your doctor is a good next step. A mammogram is an X-ray picture of the breast. Doctors use a mammogram to look for early signs of breast cancer. Regular mammograms are the best tests doctors have to find breast cancer early, sometimes up to 3 years before anything can be felt. You will stand in front of a special X-ray machine. A technologist will place your breast on a clear plastic plate. Another plate will firmly press your breast from above. The plates will flatten the breast, holding it still while the X-ray is being taken. You will feel some pressure. The steps are repeated to make a side view of the breast. The other breast will be X-rayed in the same way. You will then wait while the technologist checks the 4 X-rays to make sure the pictures do not need to be redone. Keep in mind that the technologist cannot tell you the results of your mammogram. Each woman's mammogram may look a little different because all breasts are a little different. The procedure itself usually only takes 15 minutes. You will need to make sure you schedule enough time to find parking, find the location, and fill out necessary paperwork. Upon arrival, you may be asked to complete a questionnaire about your family's history of breast cancer or other cancers, your personal history, previous screenings, biopsies, etc., menstrual history, childbirth history, and medications you're taking. To make the exam more comfortable, it's advised that you try not to have your mammogram the week before you get your period or during your period, because your breasts may be tender or swollen. On the day of your mammogram, don't wear deodorant, perfume, thick lotion, or powder. These products can show up as white spots on the X-ray. Avoid wearing a one-piece outfit. You will need to undress from the waist up. If you're anxious about navigating the process, bring a friend or family member if that's allowed. Reduce your caffeine intake for a couple weeks prior to decrease the pain. Take ibuprofen or Tylenol an hour before the procedure can also reduce the pain. Self-compression, breath holding, relaxation techniques, and communication can make a world of difference in your experience. You will usually get the results within a week or 2, although it depends on the facility. A radiologist reads your mammogram and then reports the results to you and your doctor. If there is a concern, you will hear from the mammography facility earlier. An abnormal mammogram does not always mean that there is cancer, but you will need to have additional mammograms, tests, or exams before the doctor can tell you for sure. You may also be referred to a breast specialist or a surgeon. It does not necessarily mean you have cancer or need surgery. These doctors are experts in diagnosing breast problems. Doctors will do follow-up tests to diagnose breast cancer or to find that there is no cancer. Cervical cancer is a disease of cells in the body that grow out of control. The cervix connects the vagina or the birth canal to the upper part of the uterus. The uterus or womb is where a baby grows when a woman is pregnant. All women are at risk for cervical cancer. It occurs most often in women over age 30. Long-lasting infection with certain types of human papillomavirus, or HPV, is the main cause of cervical cancer. HPV is a common virus that is passed from one person to another during sex. At least half of sexually active people will have HPV at some point in their lives, but few women will actually get cervical cancer. Cervical cancer is highly preventable in most Western countries because screening tests and a vaccine to prevent HPV infections are available. When cervical cancer is found early, it is highly treatable and associated with long survival and good quality of life. The ideal age to be vaccinated is 11 to 12 years of age for boys and girls due to the strongest immune response at that age. Early on, cervical cancer may not cause some signs and symptoms. Advanced cervical cancer may cause bleeding or discharge from the vagina that is not normal for you, such as bleeding after sex. If you have any of these signs, see your doctor. They may be caused by something other than cancer, but the only way to know is to see your doctor. To reduce your risk, make sure to get regular screening tests starting at age 21. Either a pap test and or an HPV testing starting at age 30. Talk to your doctor about the HPV vaccine. Don't smoke, use condoms, and limit your sexual partners. Two screening tests can help prevent cervical cancer or find it early. The pap test or a pap smear looks for precancers, cell changes on the cervix that might become cervical cancer if not treated appropriately. The HPV test looks for the virus that can cause these cell changes. Both tests can be done in a doctor's office or clinic. During the pap test, the doctor will use a plastic or metal instrument called a speculum to widen your vagina. This helps the doctor examine the vagina and the cervix and collect a few cells and mucus from the cervix in the area around it. The cells are sent to a laboratory. If you are getting a pap test, the cells will be checked to see if they look normal. If you are getting an HPV test, the cells will be tested for HPV. If you are 21 to 29 years old, you should start getting pap tests at age 21. If your pap test result is normal, your doctor may tell you that you can wait 3 years until your next pap test. If you are 30 to 65 years old, talk to your doctor about which testing option is right for you. A pap test only. If your result is normal, your doctor may tell you that you can wait 3 years until your next pap test. An HPV test only. This is called primary HPV testing. If your result is normal, your doctor may tell you that you can wait 5 years until your next screening test. An HPV test, along with the pap test, is called co-testing. If both of your results are normal, your doctor may tell you that you can wait 5 years until your next screening test. If you are older than 65, your doctor may tell you that you don't need to be screened anymore if you have had normal screening results for several years, or you have had your cervix removed as part of a total hysterectomy for non-cancerous conditions like fibroids. In preparation for your pap test, wear a two-piece outfit. Check in with your emotions and ask questions. It is recommended that you do not schedule your pap test during your period. Do not douche or rinse the vagina with water or other fluids. Do not use a tampon. Do not use medicine or cream. It can take as long as 3 weeks to receive your test results. If your test results show that something might not be normal, your doctor will contact you and figure out how best to follow up. There are many reasons why test results might not be normal. It usually does not mean you have cancer. If your test results show cells that are not normal and may become cancer, your doctor will let you know if you need to be treated. In most cases, treatment prevents cervical cancer from developing. It is important to follow up with your doctor right away to learn more about your test results and receive any treatment that may be needed. If your test results are normal, your chance of getting cervical cancer in the next few years is low. Your doctor may tell you that you can wait several years for your next screening test, but you should still go to the doctor regularly for a checkup. Your regular doctor can do your screening. And if you don't have a primary care physician, we may be able to help you find a doctor. Some testing may need to be done at a hospital and not at your local doctor's office or clinic. Private insurance through your place of employment or through your partner or spouse's employer generally pays for screening exams, but you'll probably have a copay. If you have Medicaid or Medicare, most likely your screenings are completely paid for. Whether or not you have insurance, we may be able to help if you meet income guidelines that are set. Even if you have insurance that covers your screenings, we can help you navigate through the complex healthcare process, like finding a doctor or specialist, special programs for financial barriers with out-of-pocket expenses. Bottom line, cancer screening saves lives. We're here to help, and please do not delay in scheduling your regular screening exams. Please share this opportunity to learn more about programs in our community that can help pay for cancer, heart disease, and stroke factor screenings.